Hello and welcome, everyone. Welcome to you all. I am Lindsay Fallon, and I am the Vice President of Education, Training, and Scientific Affairs for Division 16, and I am super thrilled to be here to start us off on today's webinar with our esteemed hosts and presenters, who I'll introduce in just a moment, but I'm going to continue letting a few people into the Zoom room here and ask that you mute yourselves and engage, at least for now, with us via chat so that we can have our full attention provided to the presenters. So welcome. Hopefully, oops, I have registration still on the slide, but hopefully you're here for addressing racial trauma in therapy using a CBT approach. We are super thrilled that you're joining us. This is one of our fall webinar series for Division 16. And we have Dr. Geremy Grant and Kelsey Matuszak. And we are super excited to hear from them in just a moment. Before we do, I wanted to share that we will send to you after the presentation the video recording, a copy of the slides, as well as your CE certificate if you signed up for continuing education credits. So that should be coming to you within the next 72 hours. And then I'm just going to mute a few people who just joined. The other plug I wanted to put in is for our next webinar in the series, which will be on October 30th. It's a Wednesday, 3 to 4 p.m. on promoting students' well-being by building their social and emotional skills. So we're really looking forward to that as well. I will say that toward the end of the presentation, we will have a link to an evaluation put in the chat. So please do complete that, and that will be what I need to see in order to share our continuing education certificate with you. So without further ado, I'm delighted to present our speakers for this afternoon. First, we have Dr. Geremy Grant, who is an assistant professor of school psychology at Alfred University in New York. He's also a New York State licensed psychologist and an NCSP. He completed his training at Teachers College, Columbia University, and aside from his faculty appointment, he serves as a consultant for Riverside Insights, which publishes the WJ4, as well as being passionate about bridging racial, ethnic, and cultural gaps in education to ensure equitable outcomes for all students and families. And he's joined by a student, Kelsey, who's a school psychology Ph.D. student at Alfred University. And in the past year, she's had the opportunity to participate in various national webinars through a graduate assistantship with Dr. Grant. And after graduation, her long-term professional goals consists of working with school-age children with developmental and intellectual disabilities in both educational and clinical settings. So we are absolutely thrilled to welcome them. Please do feel free to pose questions, comments, introductions in the chat. I will be monitoring the chat. And after the end of the presentation, we should have time for questions. If we don't, Dr. Grant said that they would be happy to share responses to questions via email. So we'll make sure we get all questions answered. So without further ado, I'm going to stop sharing so that our presenters can share their screen. And I welcome you.
Thank you very much, Dr. Fallon. Let me do my best to get to sharing here. Okay, so I already shared wrong. Do not do better than me in terms of managing technology. Give me 1 second. I shared the wrong screen with you all. There we go. Now you should be able to see the presentation. So thank you all for joining us this afternoon. It's really a pleasure to be here and be able to talk about this important topic, especially given, the socio-political landscape that many minoritized individuals are managing at this point in time. As Dr. Fallon mentioned, if you have any questions, please engage in the chat, leave comments, and we're more than happy to answer those questions via email as well. The topic for today is going to be focused on addressing racial trauma. I'm using a CBT approach. We picked that modality because most school psychology training programs train us in CBT. That tends to be the focus of our counseling and treatment. So that's why we figured this would be the most accessible to practitioners. Before I hand things off to Kelsey, just to give everyone a reminder of the learning objectives, we hope as a part of this webinar, you're going to be able to describe some of the common symptoms of racial trauma, also be able to distinguish racial trauma from complex trauma, a concept that you likely have heard about in the literature. We also hope to discuss some strategies and emphasize the importance of critical self-reflection. And then we'll be moving into that second half of the presentation on some practical points related to treating racial trauma when you're working with students of color. So I'm going to turn it over to Kelsey. You will see us turn off our cameras. We're not being antisocial. We live in a rural area of New York, and the infrastructure is not the best. So we want to make sure our bandwidth in terms of our internet doesn't get too overloaded. So I'll make sure our camera is back on, though, for the Q&A towards the end. So thank you for your understanding, everyone.
Okay, so welcome everyone. Thank you for being here, and thank you, Dr. Grant and Dr. Fallon. So I'll start us off. So to start off, we really just wanted everyone to be able to understand racism and how it presents in schools. So according to the Southern Poverty Law Center, racism is a predominant motivator of hate in schools. Believe it or not, it's actually the third most common location for hate crimes to occur. So now just to preface, when I say hate crimes, I'm mainly talking about a form of criminal offense that's typically motivated by one's biases against various races, ethnicities, religions, sexual orientations, genders, and other social groups. Hate crimes and racist events are most common in elementary schools and secondary schools, with anti-Black hate specifically being the most common. Go ahead, Dr. Grant. So given the prevalence of racism in schools, one would really think that school administrators and staff would be used to dealing with such events within the building. However, the literature shows that school administrators often overlook racist incidents within their buildings. Even though they're being reported, school administrators often don't take appropriate action to address racist incidents. The literature also shows that teachers often have implicit racial biases and therefore don't tend to engage in race-based discussions in their classrooms. And even practitioners do this too. The literature shows that they tend to avoid and minimize race-based issues when working with people of color. This could really be for a lot of reasons. It could be because they don't feel confident to do so. Maybe they don't have the proper training or experience to engage in this type of work. Or some might even worry that they may receive backlash if they say the wrong things. So here we just have some common forms of racism-related stress that can contribute to the development of racial trauma. These can include things like microaggressions or macroaggressions, which are defined as either subtle and often unintentional comments or actions that convey a prejudiced attitude towards people of color, or they can be considered more overt and larger scale acts of discrimination. These can also include things like blatant discrimination or vicarious discrimination, which include overt and intentional acts that are carried out by either strangers or by individuals that they know. Even intergenerational trauma can occur from experiencing racism throughout the generations. Similarly, historical trauma can also stem from major historical events that have opposed entire groups of people. It's also important to remember that both of these types of trauma are cumulative, and they really have a collective impact on members of affected groups. While all of these have a slightly different meaning, all of these forms of racism-related stress listed on this slide are very common for people of color to experience, even on a daily basis. Thanks, Dr. Grant. So another important aspect of this topic is knowing and really being able to distinguish between instances of racial trauma and complex trauma. So while both can be experienced throughout the lifespan and both affect an individual's functioning, The literature suggests that complex trauma results from the exposure to multiple reoccurring traumatic events over an extended period of time, whereas racial trauma is more specific to exposure to racism. Racial trauma can include constant exposure to threats, prejudice, harm, shame, humiliation, and even guilt that are associated with various types of discrimination. In this sense, experiences of complex trauma really are similar to what individuals with racial trauma experience. However, this article by Sina argues that we should think about racial trauma as being something distinct from other forms of complex trauma that we see in the literature, specifically as it differs in origin. For instance, racial trauma really comes from a racist ideology that's woven into our culture. It influences our social structures, institutions, policies, and even our everyday interactions. It's also important to recognize that racial trauma doesn't just occur during one's childhood, but it really occurs throughout the lifespan. As long as racism is woven into our society, people of color will continue to endure cumulative, constant, repetitive, and inevitable forms of racism. Most importantly, though, racial trauma also tends to become internalized as people of color begin to believe and accept what they're hearing. Unfortunately, this tends to result in self-hatred of oneself as well as one's racial group. And at its core, it really reinforces our socially constructed racial hierarchy. So based on those three major differences between racial trauma and complex trauma, CNOT also proposes this theoretical framework of complex trauma. This framework really makes it clear to scholars and practitioners that this concept is distinct from other forms of complex trauma. More specifically, this framework can help school personnel better appreciate the impact that racial trauma can have on children and families, as it really highlights the importance of prevention and intervention as well. If you take a look at this framework, you can see that many of its core elements are in the center. This includes things like internalized racism and the fact that people of color are exposed to discrimination, prejudice, and other broader systems that are influenced by racism. It also reinforces the idea that trauma is a cumulative, constant, repetitive, and ultimately inevitable experience for people of color. You can also see the various impacts that racial trauma can have on people of color. These include everything from one's physical and mental health to their social and economic well-being over the course of their lifespan. Okay, so to better understand the possible impacts of racial trauma on youth specifically, I also want to discuss some points that were made in a recent paper published in 2022. This paper noted various developmental and ecological considerations related to racism and racial trauma, really so that readers could better understand the various ways that racism can impact youth depending on their life stage. So first, at the preschool and elementary age, these researchers highlight the challenges that small children face in processing and managing racialized experiences. The literature shows that young children often can perceive racial differences at a very young age, even as young as 3 months old. While these young children in elementary or preschool age, they might lack the language and cognitive ability to fully grasp and communicate the impact of those experiences. They're often still aware that there is a difference there. Therefore, it's super important that we understand developmentally appropriate ways to discuss race and ethnicity with even our youngest of children. We have some links and resources to help practitioners do that. If anyone's interested, they're listed in the blue font under number 1. Additionally, it's also important to recognize that young children are often sensitive to their parents' stress as well, as they can experience vicarious trauma as they learn more about the racist society in which we live. Once children realize that there could be a threat to their parents' safety due to their background, they may also experience fear and worry for not only themselves, but for their loved ones too. But outside of these experiences, we should also consider many instances of historical or intergenerational trauma that can affect young children. This type of historical trauma not only affects the students themselves, but it also reminds them of the harm that could come to their family and friends. Okay, so in terms of middle schoolers, as we know, middle school often comes with a rapid physical growth for a lot of kids, for which some populations can result in exaggerated stereotyping. For example, literature has found that Black boys may be seen as older and less innocent, and that they prompt less ideas of childhood than their white same-age peers. Clearly, a situation like this can lead to things like stereotyping regarding criminality, which is especially problematic at this age. As I listed before, it's also important to recognize that middle schoolers can internalize negative racial messages and trauma that they experience. This internalization can lead to negative self-image, which is a really critical issue given that middle school is a time when kids often begin to explore their individuality as well as their autonomy. Despite having somewhat greater cognitive development than preschool and elementary age children, middle schoolers also tend to have trouble connecting the racial trauma that they experience to issues that they face with their mood, behaviors, and overall self-image. Oftentimes, issues like this can lead school officials to misinterpret the child as having a condition that needs treatment. Okay, so since students reach high school age, they typically have a greater understanding of the forms of racism and are able to make meaning of the racial encounters that they experience. Because of this increased understanding, we may also begin to see a host of differences in coping and help-seeking behaviors as students attempt to manage dealing with the racism that they're experiencing. Because no individual really copes with racial stress in the exact same way as another, it's really up to us as practitioners to gauge how our students are being impacted by racism and the ways in which they're going about managing it. We also know that if underlying trauma symptoms go unaddressed in adolescence, it can really set the child up for developing psychopathology later in life. Additionally, the literature shows that the community a student is in plays a huge role in the racial trauma they're exposed to. They may be more likely to witness or experience racial trauma in their community, even in spaces that should be considered safe, like schools, youth centers, things like that. As soon as an individual experiences trauma in their community, they may become hypervigilant to it and ultimately expect more bias in the future. As we also know, high school is a time where children really tend to lean on their peers as they play a huge role in the adolescents' lives at this time. Unfortunately, youth of color may not always have many peers who understand their lived experiences, which really limits how much support they can get from them. This often leads parents to have to fill the gap in support, which may be difficult, as maybe not a lot of parents have been able to have mature conversations with their children about safety and about navigating racism. These discussions really fall under the umbrella of racial socialization, which I'll hand off to Dr. Grant to discuss over the next few slides. Thanks.
Thank you very much, Kelsey. So that's right. Racial socialization is something really important for us to think about when we're trying to treat racial trauma in schools. It's really one way that we as school-based personnel can think about creating academic and social environments that really support youth of color and also protect them as well from the prevailing systems of racism that influence our educational system. Now, for those who are unfamiliar with the concept, racial socialization typically is described as a process where culture, attitudes, values, and other elements of an individual's background are transmitted to youth. So essentially, in this case, when I'm talking about, say, Black youth and Black families, it's how Black parents and caregivers teach their children how to navigate what it means to be Black in a world that might oppress and marginalize them due to their racial background. Now, keep in mind, moving forward, when I talk about this concept, I'm talking about it more generally, so thinking about supporting all students of color. And the literature does support that racial socialization supports Black youth, supports Latinx youth, supports Asian American youth, and so forth. So it can be very supportive of all students of color. There are various themes of racial socialization in the literature that help you to kind of think about, what do these conversations typically look like when parents are talking to their children about racial background? And I just have a couple of examples listed here on this slide, looking at racial pride and cultural socialization. So that's really focused on helping the child to develop a healthy racial identity, to feel pride and feel proud of their racial background. And that really runs counter to a lot of the negative messages that youth of color might be receiving from the media, from their peers, and from schools about what it means to be their identity. So that first theme in the bottom portion there is really important for racial identity development. And that second piece related to preparation for bias, just to describe that theme, it's related to helping students really be able to figure out, what do I do if I'm faced with racism at school or in the general community? And that can be really helpful to really provide the student with strategies that they can use to effectively manage that racist encounter. And in some cases, the management of that racist encounter is a matter of life and death, right? So being able to help have a parent be able to speak to a child about what to do if they're pulled over by the police if they're driving. That is a matter of life and death for a lot of youth of color. So that sort of conversation that parents can have with their children can also be so important for their own safety and well-being. And then the last theme that I have listed there is self-worth messages. This is in relation to helping the child to see themselves as an individual, even outside of race, so that way they can find other ways to build themselves up and to feel good about themselves. Because what can end up happening if you internalize racism is you can become so over fixated with your racial identity that you don't think about yourself in terms of the other dimensions that are also meaningful. So those self-worth messages can help an individual do that, kind of think of themselves as a whole person. So with those themes kind of laid out for you in terms of what parents might talk about when they're speaking with their children about race, these sort of conversations are really important because they support identity development for youth. They also can support the relationships that youth have with not just peers, but also with teachers and with parents. And it also protects their academic achievement as well, especially in spaces that might have a negative racial climate. The important piece that I want to highlight here is looking at the contingency on the caregiver's self-efficacy and stress. Kelsey had already mentioned that in some cases, the parents might not have confidence talking about race with their child, but the parent might also be traumatized or stressed themselves. So I think that really shows that the onus shouldn't just fall on the parent to engage in some of these conversations, but that the onus should also fall on the school, which plays a huge role in socializing and shaping the youth that are attending that institution. So although racial socialization is traditionally described in the context of parent-child relationships, schools are also responsible for promoting healthy and supportive environments for all students. And I think that part of this responsibility involves ensuring that the racial climate of the school is positive and explicitly values the identities and lived experiences of all of its members, including the minoritized and marginalized members of that school. So one way that we can promote that positive racial climate is through school-based racial socialization strategies. And again, when we're talking about now at the school level, it's how is the school transmitting messages about race and culture to those students that are attending the institution through both formal practices, so thinking about what messages are conveyed in the curriculum, and then thinking about more informal, so are there spaces within the school that allow the child to present their authentic selves? Are there posters, literature, other things that are more extracurricular that also allow the child to see their own identity? Like those sort of things are very important to help the racial climate. And we want to make sure that whatever we are conveying to students, that it's positive and that it's accurate information as well. There are two strategies I have listed here. I did briefly mention the curriculum component to the left. So centering narratives about BIPOC populations, specifically related to resistance. So highlighting, all of the great leaders and all of the movements that have occurred throughout history and are still going on to try to disrupt and dismantle racism. And then also having narratives about empowerment, showing instances of strong leaders of color, strong community members of color who are able to still experience joy and really thrive despite living within a system of racism. Like, curricula need to provide that sort of narrative to be able to instill hope and encourage students to be able to advocate for themselves. Then I think the second point is important too. I think that any change in a school is going to occur from the top down. So school leaders need to facilitate conversations regarding connections between white supremacy and racism. Those concepts need to be tied to historical and contemporary events within the school. So that way individuals can understand the ways in which youth of color and families of color have been harmed, and the ways in which then we can start to undo some of that harm by dismantling systemic racism. So this is kind of more at a systems level, just thinking about strategies that the whole school can engage in. And there are more resources that are listed on that hyperlink by DAS. And then Salim and Bird also have a model of racial ethnic socialization for anyone who is not familiar with the concept, especially it being applied at the whole school level. They have a very good model that I would encourage everyone to review. But getting into why a lot of you likely registered for today, talking about treating it more so at the individual level in CBT. And I think it's important, before I jump into two different ways in which we can think about treating racial trauma using CBT. I think it's important to highlight that not everyone can just jump right in and treat racial trauma. It takes a very specific kind of provider to be able to do this. And the literature highlights that there are particular skills that this individual should have. And I think this is important to go through, because supporting any minoritized group effectively first requires that the provider take stock of the skills that they possess and those that they need to build upon in order to effectively serve the members of that diverse group. So you can see here 3 different domains of functioning that we feel are very critical if you're going to successfully treat racial trauma. The first kind of bucket of skills that you need involves knowledge and skills related to your own personal identity, including your racial identity. Now, this manner of critical self-reflection should involve some sort of analysis of your cultural development. So if you are a white provider, kind of thinking about, how did I learn about what it meant to be white? Have I even grappled with what that means at this point in my life? So you would kind of have some of those conversations with yourself. You would think about your worldview and kind of what are your thoughts about the social hierarchies that exist? What are your thoughts about the fact that some folks have social privilege and some folks do not? So you kind of think about some of those elements as well. And then I think it's also important, looking at this second bullet here, being able to think about anti-racism and allyship and taking stock in what have I really done to disrupt the system? Am I continually working towards being a better ally? So kind of having conversations around that with yourself, and thinking about whether you can address cultural insensitivities. So are there any biases, any unchecked privilege, or any other factors that might result in insensitivity when you're working with someone who is culturally dissimilar from yourself? Now, I did mention white providers before, because a lot of the literature does talk about supporting white providers in their pursuit of being allies against racism. There are 2 papers that we have hyperlinked here, one by Sue and one by Graffin and Goldie, that we feel are really important. They provide information about challenges that white providers might face in coming to terms with their white racial identity, while also trying to work towards being an effective ally. So I think those 2 papers are very good reads and prerequisites before you try to jump into addressing racial trauma in practice. In addition to having knowledge about yourself, this middle section here is looking at knowledge and skills related to culture, race, and ethnicity. So I'm thinking here about someone who has critical consciousness, someone who has knowledge about the world around them regarding social and political issues. And that also requires you to have an understanding of the different systems of oppression that might be affecting your client. I think we all know about intersectionality and how you can have a client who is minoritized based on their racial identity, but they might also be minoritized in terms of their economic background, their gender identity, and so forth. So I think it's not enough just to think about race. We need to also be thinking about some of these other systems as well. But in the context of treating racial trauma, I do think at the bare minimum, the provider should have a grasp of microaggressions, including their various forms and the way that they can impact functioning. And folks should also have an understanding of the historical context of racism and the contemporary context of racism. So that contemporary component requires you to kind of stay up to date on how racism is affecting communities of color. And then the last component that I have listed here, understanding models of racial identity development. There are different models that talk about the different stages and the ways in which an individual kind of comes to terms with being white or being a person of color. And although those models are based on general information, they do provide a good conceptual understanding of identity, and they are great resources, especially when you're first starting out trying to understand an identity that is different from your own. They're a really good starting point in that way. So I do have a hyperlink listed on the slide to one of the identity models that can be helpful if you're trying to better understand racially minoritized individuals. And then that last section I have there for clinical skills, clearly if you have knowledge, that's great, but you need to be able to have the skills to utilize that knowledge in practice. So the first skill that's super important is making sure that you approach your sessions with a willingness and ability to learn about the client's culture. So kind of approaching your work by saying, I can't know everything about the client's background, even if I've done extensive reading and knowledge building. That's super important, because if you're not willing to learn about the client's culture, then you're likely going to minimize or avoid cultural conversations in session, and that can be microaggressive to that person. Similarly, you have to be willing to discuss racism and cultural issues. Again, if you minimize or avoid, that could be a slight. And then the last 2 points are equally important. Being able to repair clinical ruptures. So if you do commit a microaggression, do you feel comfortable owning up to it and providing a sincere apology and a direction to move forward? All that's super important to repair that clinical rupture. And then lastly, being able to identify or diagnose racial trauma. You need to be able to identify specific tools, clinical interviews, other methods of assessment that can help you to discern whether or not this individual that you're working with truly is presenting with racial trauma based on how the literature defines it. Okay, so before I get into 2 of the specific modalities that you can think of, I just want to highlight some common themes that can come up when you're trying to treat racial trauma in session, just so when you try to do this in your own practice, you know what themes might come up. So we might see some acknowledgement. So there might be some issues where survivors of racial trauma might struggle to acknowledge the violation, and they might struggle to recognize a racist incident as actually being racist. So that's something that can happen in the treatment of racial trauma. Folks may also struggle to share or self-disclose the experiences that they've had. In terms of safety and self-care, we might see that survivors might need help determining their current level of safety, and we might need to work with them to establish a safe and stable environment. Looking at grieving and mourning losses, this is specifically tied to a theme around acknowledging and addressing losses that might be precipitated by the traumatic event. Now, that loss could be someone losing a relative, a friend, a colleague due to racism, so such as like a hate crime. This could also be mourning the loss of a lifelong friend upon a rupture that might occur due to differences in perspectives related to racism. But this is another theme that can come up in practice. Kind of tying into the point that Kelsey was making about internalized racism for youth, there can be a lot of shame and self-blame that's tied to that internalized racism, where survivors might take responsibility for the racism that they've been exposed to, and they might blame themselves and think of themselves as being the reason why the incidents have occurred in their lifetime. And then looking more so towards the left of this diagram, we do have anger. This is quite common just with anyone who's experienced a lot of trauma, where clients might experience anger or frustration as a result of the traumatic event. In terms of coping strategies, this is tying in where clients may need some assistance identifying personal coping mechanisms and adaptive skills. And we know that when folks are exposed to trauma, they might adopt maladaptive strategies to cope in the short term. And those maladaptive strategies might lead to worse long-term outcomes. So this is why it's an important theme to discuss when it comes up. And then lastly, resistance strategies. These are strategies that are specifically related to, how does this person manage daily racism? How do they combat it? How do they push back against it? That's what those resistance strategies are talking about. Now, I just want to highlight that depending on the specific situation, depending on the specific incident related to racism that the client may have experienced, you might see all of these themes in your work. You might only see one of these themes in your work, but I just wanted to give some general overview of what you might see if you're trying to treat racial trauma. So then how do we do it? So I'm going to talk a bit about two different approaches. Under CBT specifically, we have the Healing Racial Trauma Treatment Protocol, which was designed by Williams and others back in 2023. And then as long as I have time, I'm going to talk about trauma-focused CBT and how we can weave some culturally responsive elements into that. But I'll start with this treatment protocol here. So it's a 4-phase approach to treating racial trauma that is rooted in CBT. And the first phase of this treatment protocol is assessment, right? In any form of work that we're doing, especially if it's social emotional health that we're working with, it's assessment that we start with. And this involves the goal of understanding the scope of the client's racial stress and their trauma. And during the assessment, just like how we all should know this, that providers should validate the client's experiences and provide support and affirmations to establish and deepen that rapport. Because the big part of that assessment when we're first meeting them, it gives us a chance to show them that we understand we're going to do our best to understand their experience, that we're there to listen and support them, and that we're not going to provide any judgment whatsoever. That's super important. Even more so for students of color who might be working with a white provider who may have experienced a microaggression or a slight in the past at the hands of a white provider. They might come into the relationship with a little cultural mistrust. And so it's really important during this assessment phase to really do your best to empathize and support them as much as possible. Now, the provider should aim to assess racial stress and trauma using empirically supported scales. I have a couple listed on this slide for your further review. In addition to using those skills, though, we also want to make sure the interview protocol we're using has targeted questions related to racial stress and trauma, and also has some questions related to culture in general, so you can get an understanding of the way that cultural elements kind of inform that client's life. So I have some examples listed here of racial ethnic assessments towards the top that are hyperlinks that you can click on, in addition to interview protocols as well, listed towards the bottom for your consideration. I do think it's important, before I leave this slide, that you do need to gauge the presence of other forms of trauma when you're working with a racial trauma case, because trauma is cumulative. Oftentimes folks that have experienced one type of trauma have experienced a different type of trauma in your life. So there's a high possibility of being a poly victim. So having that poly victimization because you've experienced those multiple traumas. So if you're going to be looking at racial trauma, I would also think about more general forms of trauma as well. So again, first we start with assessment. And then after we conduct a thorough assessment as a part of this treatment protocol, we focus on something called stabilization. Now, Williams and others describe this part of their protocol as stop the bleeding. because at this point in your work, the client is likely going to be very distressed, really having trouble just functioning day to day. So the idea here is to help the client be more stable, get them into a better place, so then we can get into more deep work related to the trauma they're experiencing. So you'll see that there are 3 different sub-elements to the stabilization phase, and I'll give you some context for each one. So in terms of making sense of racism, the goal there is to help reduce shame by helping the client understand racism is caused by society and that racism is not the client's fault. That's super important because that's getting at the internalized racism element that so many youth and individuals of color can end up developing due to racism. And how do we help to reduce that shame? Well, there are a few techniques, and we can use psychoeducation regarding racism and how it can affect mental health and well-being. We also can, as a part of our work, make sure that we're not lecturing the client when we're using that psychoeducation. So we should really gauge what the client knows about racism first and what their experience is. So for example, I might say with the client, share with me the ways in which racism has impacted your life. How would you feel? How would you think about that experience if racism was not, a system that you had to manage? Like, what might your life look like? So kind of getting a general sense of, do they kind of perceive racism's impact on their life? Can they think about what their life might look like if racism did not exist? Asking questions like that can help you get a base understanding of how the client thinks about racism and its impact on their lives. And that can then help you identify any gaps that you need to address as a part of psychoeducation. In terms of coping and self-care, this is also very important. If the client is highly distressed, they might not be using functional strategies to manage their distress. They might be using more dysfunctional strategies such as substance abuse, self-harm. They might have intense suicidal ideation, and they may have attempted suicide at one point. So it's really important for us to assess what they're using in terms of coping. In terms of cultural coping, I do want to just quickly point out, I don't have it listed here, but there's a concept called John Henryism, which is pretty prevalent for folks of color. This is when people of color overexert themselves, or they put forth a lot of effort over a prolonged period of time in hopes of being viewed as equal to their white counterparts. This can happen in schools where students try to overperform to disprove a stereotype that their teacher or peers might have about them. And you can imagine how taxing that is over time to just try to overexert day after day. That's going to lead to that person being burnt out. One of the only other points I want to mention about coping here is that just remember that all behaviors serve some function for the individual. So it's really important to discuss those coping strategies with the client. Do our best not to judge that coping strategy, because we want to let them be open in that discussion so we can understand what is that coping strategy doing for them. And if it is maladaptive, we can then provide psychoeducation around more healthy strategies that they can use long term, so that way they can have some replacement behaviors that are more adaptive. The self-care component should be discussed with coping. It's a separate concept in the literature. And what I mean by this is we need to gauge what the client is doing to promote their well-being. Literature highlights in the context of students of color and people of color that there is racial self-care, which is related to how the person might be engaged in activism and advocacy and community with other people of color, doing these different things that help them to resist racism, but also gives them the opportunity to feel empowered and feel pride related to their racial background. So I think when we talk about self-care, just think about racial self-care as well. And then that last component is important, cultivating a support network. So to stabilize that client, we need to make sure they have individuals they can lean on, they have resources they can utilize. So it's important for us to identify what are the existing supports that client might have, and also think about how can we enhance their network if necessary. Once we get the client stabilized, the treatment centers on healing the client through things like cognitive restructuring, exposures, and also having them engage in reevaluation exercises as well. These three elements are woven into the four components that you see here of the healing phase, and I'll give you an overview of each one. So as we've been mentioning a few times before, this internalized racism is really impactful for individuals of color. So the part of healing involves dismantling this internalized racism. So really the hope is to help the client identify its presence so that they can see, I have internalized some untruths about my group and some stereotypical thoughts about my group. So helping them to identify that, be able to reduce any shame that might be tied to it, especially if those beliefs led them to mistreat either themselves or members of their racial ethnic in-group. And we also want to increase their feelings of belongingness. We want to help them feel as if they are connected to their in-group and that they can explore their culture in a way that they can build appreciation for it. The second component that's listed here kind of builds on psychoeducation in the first phase, so helping them to better understand race and also to better understand the ways in which white supremacy might play out in the social context they exist in. So for example, the student might be able to think about how the curriculum doesn't show any positive markers of their racial ethnic background, but it does show positive markers of dominant racial groups. Being able to kind of think about that is going to be a component of that healing phase because that can help the client be able to think about where racism might exist within their social spaces. That can give them a better sense of control where they can predict where racism might occur. So that's really the important piece around that understanding, helping you to predict where it might happen. Then the last two components here, exposure and processing of racism-related experiences. So if you've worked with clients who have experienced traumatic events, you know that having them retell those memories in a space with the trained professional can bring down some of that stress and that distress in a healthy way, and it can reduce their anxiety as well. So when we think about this process for individuals of color, we do want to think about this retelling and processing, but maybe through things like storytelling, songwriting, or even spiritual communion as well. So things that might be more tied to the client's cultural expression. And that'll allow them to reinforce those cultural practices as tools that they can use to heal, while also allowing you to bring in their culture and reinforce your focus on being responsive to their background in practice. The last component that I have there, learning strategies to combat racism. This is specifically related to enhancing a client's self-efficacy and confidence to act when they encounter racism and discrimination in the future. This is really important because if someone has been experiencing internalized racism, they might feel very hopeless, or they might habitually avoid settings where they might have experienced racism in the past. A concrete example of skill building in this area is specifically related to providing psychoeducation and training on responding to microaggressions. There are trainings that are available through Sue, Daryl Wing Sue, and also through Williams, who has been cited on numerous slides as a part of this presentation, that can provide strategies where clients can intervene if they experience a microaggression or experience something at the institutional level. I do want to just quickly highlight, though, that we always want to keep in mind, if we're trying to teach people strategies to combat racism, that there are contextual factors like their safety and well-being that we always have to keep in mind. And Williams suggests that the type of response a client needs to learn how to provide is going to vary based on the relationship they have with the perpetrator, right? The way in which I might provide strategies and support a student in reacting to a best friend is vastly different than a stranger that they might see in the community. So that's really important to keep in mind. So even if we try to teach folks strategies for advocacy, we always want to make sure that the person's safety and well-being comes first. So always check in with the student when you're coming up with strategies, who exactly they're trying to address the racist related incident with. And then the last component to this treatment protocol that I want to discuss is the empowerment phase. The empowerment phase involves the client learning to resist and further combat racism to maintain their mental health and wellness. Now, this part of the treatment protocol is very important because now the client is actually taking some of the learned strategies from the healing phase and trying to apply them within their lived experience, so outside of the therapy room. The goal of this is to increase their feelings of agency, to increase their self-efficacy, while also reducing feelings of helplessness and victimization. Obviously, keep in mind if we're trying to encourage a client to go out and say, disrupt a microaggression if it occurs in the classroom, we want to make sure that that exposure or that experience isn't like all the way at the top of their exposure hierarchy. We want to make sure that we're doing these exposures in a graduated fashion, so we don't place the client in a position where they won't have the necessary coping skills to manage the stress that comes with that interaction, where they might end up just being re-traumatized or further distressed. So just like with graduated exposure, we want to help the client identify possible situations that they'd like to address within their lived experience. We then want to think about what are possible outcomes if they try to advocate for themselves. And we also want to think about what skills they would need to be able to do that level of advocacy and assess those skills before they're encouraged to do it in real life. So that all relates to this first component here at the top. Additionally, we want to think about growth and helping the client make meaning moving forward in their lives as a part of our work. This is really important because we want to be able to help the client develop a deeper pride and appreciation for their identities. So Williams and others talk about how part of that process for meaning making could be helping the child learn about exemplars who have resisted and combated racism successfully, in addition to those who challenge stereotypical narratives within the media. Meaning making also can connect to spiritual resources and interventions as well, especially because many individuals of color are very spiritual and do lean on religion as a support network. So Williams and others also note that we can encourage the client to use religious rituals and practices to create a renewed and meaningful life in the aftermath of trauma. Now, if you're unfamiliar with your client's form of religion and spirituality, please consult with providers who have expertise in that area. And what you also can do is, some cases, therapists, providers can consider collaborating on the care of that individual with pre-existing religious figures in that person's life. So I've known of practitioners to collaborate with priests, with pastors, as long as the client and family are okay with that, then that's something I've seen people do as well, so they can bring that religion and spirituality into their work. I'm going to go through the last two bullets, and I'm keeping an eye on the time as well. I do want to give some time for questions. So I want to go through the last two bullets very quickly with you all. So thinking about furthering that empowerment, a broader focus can be achieved by equipping the individual with the skills they need to be an activist and to take social action. A lot of the literature highlights that in history classes, those are really great places to be able to equip kids with the skills, because those classes can teach them about issues happening within the world, issues that have happened in the past. And those are also classes where they might be able to do an activity where they make a petition related to supporting a minoritized group, or they talk about advocacy for anti-racist or anti-sexist or other types of policies. So history classes tend to be a good place to really build up the social action and activism related skills that kids would need. And I think, in some cases, we might even need to step in here, especially if there was institutional harm done to the client. So if something happened where a policy was very clearly discriminatory and it caused harm, we might need to step in to provide support and allyship to determine ways to disrupt the system itself that causes student harm. And then the last part of this treatment protocol is looking at, ending the treatment and really focused on relapse prevention. So you're kind of just summarizing your course of treatment with the client and really making sure that they have mastery of learned techniques. And I think one way to really do this is to think about what has the client experienced before in their lives? How would they manage this again if it were to happen? And then also brainstorming with that client any additional supports that they might be able to avail themselves of. I think all of that's very important prior to ending that therapy with the client. Okay, so I know I only have a few minutes left. I know we started at about 3:03 Eastern time after the introduction, so I'm hoping folks can hang out until about like 4:05 Eastern time. So just about 8 more minutes or so. I want to be respectful of everyone's time. I do apologize for not getting through these last 2 slides, because I do want to leave time for questions. But if you do have time to review, I can have trouble saying names sometimes, so I apologize. Metzger's paper from 2021, they talk about infusing racial socialization and considerations for managing racism into TF-CBT, or trauma-focused CBT. So I think that that's very important for those who specialize in that form of CBT, whereas the healing racial trauma treatment protocol, that's more specific to CBT, generally speaking. So thank you all for listening. I do want to take some time for questions at this point. So I'm more than happy to answer some of them. I'm just going to take a look at the chat to see what questions we have here. Okay, so we have one. Oh, go ahead, Dr.
Oh, I
Brown.
was just going to say, I think the only question I've seen so far is the one at the very bottom. So if you wanted to address that one first, feel free.
Sure, I can. So let's see. How do we balance assisting a client in cognitive restructuring of beliefs or experiences regarding racism without engaging in minimization or microaggression of our clients? I've seen some critiques of CBT as a treatment modality. Thinking about cognitive restructuring can be invalidating for some folks. Yeah, that's a really excellent question. I think in many cases, the restructuring can certainly feel like we are invalidating the client if we don't first validate and acknowledge what they're saying. So let me give you an example. If I have a client who has told me that they know 100% for a fact that if they go to their classroom, the teacher is not going to listen to them, even if they raise their hand, because this is something they've experienced last year in a totally different setting with a totally different teacher. I can validate that experience, and I can highlight how disappointing it is that the school personnel, subjected them to that. But then I can also kind of brainstorm with them some of the differences in this new experience that they're concerned about, such as this is a new teacher, this may be a new school, this may be a new class. So I can kind of brainstorm with them some of that to kind of get them thinking about how the context that they were in previously is different than the context they're in now. And I think part of the restructuring that I would do is, working on that habitual avoidance. So that way they can think about, I can attend class, and if this does happen, what can I do to address it? Versus I'm not going to attend class at all because this happened in a totally separate environment. I think that's how I might kind of think about that piece, trying to get them to see some of the context related to the previous experiences, trying to also get them to see other strategies that they may have been able to use in those previous situations, and also being able to provide some sort of support or evidence that suggests that this new setting they're going into might not lead to the same experience. So thank you. I'm glad that that helped. That tends to be the way that the literature highlights it. When we're doing that restructuring, it tends to be thinking about really helping them analyze that context and make sense of it. Really also validating as well, like in that context, yes, you experience some horrific things and we don't want that to happen again, but then helping them to kind of see what has changed since maybe last year in terms of your approach to managing racism, and thinking about the new setting. Is there anything that might have you think this won't occur? And if they say it definitely will occur, then still, we can still talk to them and kind of brainstorm, if it does occur, what can we do as a team to help you push through this because we want them to be successful in school. So excellent question, Isaac. I really appreciate that. Any other questions that folks might have? Because I only do have 2 more slides, so I almost wonder if I can get through them just to do a quick overview, if folks are willing to stick around just for a couple of extra minutes. But I also want to wait to see if anyone has any other questions before I talk about the TF-CBT slides. Okay, it doesn't look like folks have any other questions. So Dr. Fallon, do you think I have time to get through those last 2, or would you like me to end it here? Dr. Fallon might have stepped away. Well, I'm going to jump into them since we still have a couple of minutes. As long as that's okay, Dr. Fallon, I can finish the last 2
sorry,
slides.
I got an emergency phone call. They didn't realize I was in the middle of this.
That's perfectly fine. Okay, let me jump in then.
Yeah. Go ahead. I have one question for you too, if we have time at the end.
Sure. So let me get through this one really fast for folks. So TF-CBT, for folks who are familiar with it, there are 8 components of TF-CBT. What this paper talks about is weaving in racial considerations into each of these components, which I think is really important. And I think that in terms of these components, it's pretty flexible, but I'll talk about psychoeducation first. Obviously, just like with the trauma treatment protocol, psychoeducation is very central to infusing racial considerations into trauma-focused CBT. So children need to be, and parents need to be provided information regarding symptoms of trauma. And that's not just racial trauma, it's just trauma in general. So what does trauma kind of look like? What can it do in terms of affecting major life domains and development? This can be achieved through handouts, bibliotherapy. I've seen some folks kind of use games in a therapeutic way to talk about different exposures that folks may have had in the past. I personally always just use bibliotherapy, trying to use different books that children can relate to. There's a great one that I'll just call out called A Terrible Thing Happened by Holmes and Pilo. It's a gently told story. It's illustrated for children that may have witnessed any kind of violent or traumatic incident. So I think, if we're talking about racial trauma, if someone has witnessed some sort of, hate crime or something along those lines, it's a more general trauma book, but it still hits at trauma as being a theme in children's lives. So I think it's a pretty good text. When we're applying racial socialization and race-related considerations to psychoeducation, though, we obviously want to include language that validates the negative experiences that families of color may have had. And this goes back to highlighting like the clinician needs to be aware of racism and discrimination in society, because if you're not aware of it, you might use language that actually is invalidating. And if you're not aware of racism and discrimination, you might close the door on discussions related to racism when the client brings it up. So that's why I was mentioning before, it's so important for us to be knowledgeable on these topics, because then if we're providing psychoeducation and parent training around these topics, we need to have a background in it. In terms of parent training, what this article talked about was really helping parents develop just skills to manage behavioral problems that can come up if a child has experienced trauma. So aggression, tantrums, significant withdrawal. So helping the parents to kind of connect those behaviors to the trauma, so they don't think that the behaviors are some characterological flaw of the child that they're supposed to punish, but rather helping them to understand that this is a consequence of something really severe your child is experiencing. That can help build empathy between the parent to the child, and also can help the parent understand, I need to step in to provide support as a caregiver and not necessarily like an authoritarian. So according to this article, they talked about helping parents to be able to discuss with the child their traumatic experiences, because again, some parents might withdraw if their child brings up a racial incident. So helping parents be able to sit with that. And also helping the parents to be able to share like how they manage those racial incidents as well, so they can model racial coping and racial self-care for their children. In terms of relaxation skills, this is very common as to what you would expect with other types of trauma that we might treat. So helping the person get back into control with their body. So we might use mindfulness strategies, controlled breathing, muscle relaxation, guided imagery, and so forth. I do think, though, it's important to highlight again that there might be some cultural relaxation skills that we need to keep in mind. So maybe there's something related to religion and spirituality that might be relaxing for the student of color. So we don't want to overlook that. And I also think it's important, really quickly, with relaxation, just super quick to mention that for many BIPOC groups, there's a huge message of you have to work twice as hard to see the same result as like your white peers in spaces. So if kids have gotten that message from their parents, relaxation skills might be non-existent. So I think that's important to highlight as well. So maybe I would start with relaxation skills, asking kids, what are their thoughts on relaxation, and how do they relax? Because you might have a student that says, my parents have told me I can't relax or I'll fall behind. So I think that's important. And then looking at the last two, effective identification, we know that kids exposed to trauma oftentimes have trouble articulating their emotions. So we want to make sure that we help kids to be able to identify those emotions, be able to connect it back to the trauma, and be able to speak to it. For kids of color particularly, even if they can identify the emotion, they might suppress it because they're scared of being stereotyped. Like if you're working with a young Black boy and he's very angry, he might be stereotyped, be afraid of being stereotyped as aggressive or hostile or rude. So we need to, in this process of helping them identify their emotions, we need to also validate the fact that in some cases they might not have been able to express these feelings because of societal barriers. The only other point I have for effective identification is if you're using any feeling spaces or anything like that, just make sure that the material you're using centers individuals of color. There are plenty of free stock images of children of color showing different emotions, and there are plenty of books that have characters of color who talk about emotions. If folks need any resources, just reach out to us, and I'm happy to provide a list to everyone. And then lastly, cognitive coping. This is teaching the child and caregiver how thoughts can impact feelings and behaviors. So like that cognitive triad in CBT. And this is really just helping the child to be able to evaluate any thoughts. So testing the evidence, looking at thought records, especially if they might have some hypervigilance or really they have these strong expectations that they're going to experience racism in every setting. So I think it's really important to help the client then kind of understand, when have you experienced discrimination before, and then help them to identify healthy cognitions and ways to manage that for the future. And really quickly, the last points that we have here, last four kind of stages, looking at trauma narrative development, so talking about the trauma with the child. It's really important as a part of a racial consideration to consider asking the child how they want to communicate the narrative. There might be, again, a cultural element of maybe there's a fable or a story that really ties closely to their trauma. Maybe they want to present it through poetry or music. Don't assume that the child just wants to talk about it verbally through a general conversation. Give them some latitude in terms of how they develop that narrative. In terms of in vivo exposure, this goes back to very similar to the trauma treatment protocol, exposing the child gradually to trauma-related cues, including any memories related to the trauma, because again, we want to minimize avoidance to any reminders of that trauma that might be impacting the person's success in school and life. The article talks a lot about how we should look for separate harmless triggers that may have developed due to previous exposures to racism. So for example, I'd mentioned a student not going to class because they're afraid something might happen. And the article gives the same example. A student might avoid going to class due to fear of being perceived as not good enough, even if they've never gotten that input from any peers or teachers previously. So if you see that kind of anticipatory concern, that's something that we might be able to work on first, because that's more of a harmless trigger. There's nothing in the environment that's supporting the trigger's presence. except for possibly internalized racism that we can work on with the client directly in session. I will say, though, that if the student has developed into an anticipatory concern, due to racism, and there's concrete evidence that's supporting that the anticipatory concern is definitely founded based on how the school is functioning, we should be working to address those issues in the school context, in addition to supporting them in session as well. And then to the last 2 points, there are conjoint sessions in TF-CBT, so making sure the caregivers work closely with you and the student, so that way they can practice any skills that are necessary to promote a better home environment, and also to provide the parents with ways to encourage their child in order to build up their well-being and mental health as well. And I think it's really important too, if you do have caregivers who are shying away from this trauma and aren't available to their children in this way, these sessions can be designed to have the caregiver like hear parts of the narrative so they can better understand it, and better be able to empathize and sit with it, so they can better support their child as they continue to face discrimination moving forward. And then the last point here is just enhancing safety. So this is making sure that the child and caregiver are provided personal safety skills to prevent future trauma experiences. So this could be looking at teaching folks how to respond to microaggressions effectively, teaching them how to intervene at an institutional level if they need to, or a community level. So I think that also is important kind of area to focus on as well. I know I kind of ran through that really fast, but I know we also went over, so I was trying to get something in for each of the slides. So I do want to thank everyone for their attendance and focus today. If anything kind of went by too quickly for folks, feel free to reach out to us, and I'm more than happy to chat about this topic day in, day out.
Thank you, Dr. Grant. I feel like when we originally talked about this, you had proposed a 2-hour, and it's clear we could have kept going for another hour. There's so much to discuss. So maybe you'll have to come back and do a part 2.
We'd love to do that. I know I'm speaking for Kelsey, but we'd love to do that.
Yeah. I just had one quick question. You presented some incredible slides about skills to teach treat racial trauma. And I was just thinking about, as a trainer in school psychology, or, variety of field, subset of the field, we all have to go through training. And I guess how you recommend, or if there's strategies in the literature around like sort of teaching these skills in the context of training programs, or if you're in the field, how to get more, skill acquisition around these skills.
Yep. Yeah, that's a really great question. So I think for the first bullet, knowledge and skills related to personal identity, at least in the cultural diversity classes I teach, the students have to do very specific assignments where they are reflecting on various identity dimensions and how they might inform practice. So it's kind of built into the course in that way. So that's one piece. I think another way to kind of build your personal identity up would be reading literature by scholars and practitioners who share a background that you do. So there's a very great paper that I can share with you to share with the attendees. It was written by a white female school psychologist, and she talks about how her socialization might impede some of her practice. And I think that's a good way to kind of see, like, if I identify as that background, is this perspective bringing up points that I haven't even thought about yet? And if you share the same background, then some of those perspectives might overlap with your practice as well. So I think I've learned a lot reading from like scholars of color and how they kind of approach this work too. So I think kind of doing some structured activities, reading from scholars who kind of share some of your background. And then also I think the addressing cultural insensitivities, I think that's where like mentorship and supervision and even consultation with peers can help. So kind of going to someone else and saying, this is how my session went. This is what my client kind of was concerned about. This is how I approached it. I think I did that correctly, but what's your outsider perspective? I think leaning on other people in that way is always fine, as long as we maintain confidentiality for the client. So I think that's the first bullet. Second bullet, knowledge and skills for culture, race, ethnicity, like do reading, like definitely do reading. There's a great critical theories text by Sherry Proctor, and I forget the other author, so I apologize. But there's a great text for school psychologists there. I also think that attending webinars like this, attending conference presentations by scholars of color who are doing work in this area is super important as well, because then you're getting their lived experience woven into the discussion. And then I would also say, like, do your best to attend events that also are centered on this, that are more informal, just so you can kind of understand, like, generally speaking, what is this group's lived experience and how do they kind of perceive the field. I think that's always nice. And then in terms of clinical skills, I would say to make sure that folks do research on validated scales and surveys and assessments for individuals of color if they're trying to treat racial trauma. And when I say do the research, I don't mean just like read about it. I mean like actually see the measure and think about how they would actually use it in practice. Make sure, again, if they have a supervisor, encouraging that supervisor to maybe sit in on a session where they might be trying to do some of this work so they can have a second opinion. And then I think in terms of like professional development, I'm pretty sure APA has done series on kind of building cultural competence. I'm pretty sure they have a couple of series related to diversity, equity, and inclusion. I know NASP has a few recorded webinars. The Black School Psych Network, if folks ever want to attend their summit that's annual, there's a ton of great trainings related to supporting students of color there. And yeah, I think that otherwise I would probably look at my state association and see what opportunities they might have for further training too.
Thank you so much. It is almost 4:20, so if others have questions, feel free to enter them into the chat or unmute, but if there are no further questions, we can conclude today's presentation and really appreciate all of your attention and hanging out with us a little longer than planned. Wonderful. Thank you all.
Thank you, everyone. Take care.